Hey, it's Paul Palmer again, and I'm back talking to Natasha Todorovic-Cowan. Hi, Natasha.
Hey Paul, how you doing?
I'm good, thank you. I hope you are too.
I am. We've got rain, and that almost never happens in California. I'm excited about that.
So you can have plenty of rain if you come to the UK. In
How
England,
do we exchange?
plenty of rain. In fact, we've got a bit of flooding at the moment.
Well, I'll take some of your rain, and you can take some of our sun. Does that work?
That sounds good to me. That sounds good to me. Let's
Deal
do
done.
it. That's a good change for us. That's a good one. So it brings us on to today's topic. So we're talking about change. And an interesting thought I had recently was about how people change medication, how the doctor decides which test they're going to do, which medicine they're going to prescribe. So usually they'll go ahead and they'll do some tests. Maybe they'll do some blood work. Maybe they've done the assessment of the physical characteristics, and maybe they've done some sort of scan, and then they identify which um, which medicine they're going to give them, whether that be a tablet, whether it's a cream, whether it's an injection, a vaccine, whatever the choice is at from based on those results, they make the change. And then that made me think about our previous conversation about how we make changes within the organization. And I think you mentioned on our last call the change. What did you call them? The assessments for identifying how people are behaving, to look at what's causing a change to fail and how we can adjust to actually preempt failures before we start making the change, maybe as part of the team or something else. But I think I'll let you explain that part, Natasha.
Well, yeah, I think, the metaphor is that if you're a reputable physician, you're not going to reach into a random box with a bunch of drugs and hand your patient a box of pills. And that's what we're doing with change. That's the equivalent of what we're doing with change. We're just saying, okay, we want that, so just take this pill. And our spiral dynamics change readiness assessment, for example, breaks down the different departments and the individuals within those departments and the organization as a whole, and what change phase it's in, the kind of change it needs, the kind of change that particular department needs, so that the change is as tailored to the individual and the department and the organization as medicine is to the patient.
So what I heard you said phase, but I'm not quite sure what you mean by the phase.
Yeah, we go through various phases as we go through change. So we talked about people not wanting to do anything, right? Well, that resistance phase is part of those phases of change. When we're seeing things and we don't want to do it, or we don't think it's in our interest, or we don't understand it, we're going to resist. Like, why do something that's not in your best interest?
Yeah.
And sometimes we've got to change our thinking. Sometimes we've got to change our behaving. Sometimes we have to change our relating. And that takes practice. It takes understanding. It takes a willingness to do things differently. And resistance isn't going to get us into the practice phase. So we've got a phase where we're resisting. We've got a phase where we're mourning loss. We've got a phase where we're practicing and failing. We've got a phase where we're actually seeing things starting to click. So we've got to know where we are in terms of those phases for change. And then each time we support it with something that is absolutely aligned and congruent for what is needed for that person, for that department in that phase.
So coming back to the metaphor, I'm thinking of if if somebody's having an operation, often they would have an antibiotic in their pre-operation in the lead up to the operation to make sure that they're as fit as possible. Maybe they've had some vitamins, maybe they had some other treatment before they go in for the op. And during the operation, they'll maybe have some fluids, but they'll probably have some sort of anesthetic. Maybe they'll have. It's quite common to have a different type of antibiotic to prevent the infection that might flare up after the event. And then you might have something that calms, something that reduces the reaction to whatever's happened during the operation, something that stops you rejecting anything that maybe has been implanted, or makes you accommodate whatever that's been changed within. So that's the same sort of thing, isn't it? So the assessment tells you how you need to behave at each stage. The same way as if you're looking at your I need to come back to the electronic quality management system again that we were talking about before, because you can have a scorecard, and on that scorecard, it assesses the different systems within your manufacturing business, whether that's pharmaceutical or medical device, and you use a dashboard or the scorecard. There's a few different names for it, and you can use it in like a needle format, or you can use a graphical format. But basically, you're showing the health of your quality management system. And if your quality management system's healthy, then you keep going and you improve. But if you see that something's deteriorating, then you need to diagnose what's wrong and identify the change. And then based on what you've been talking about, we then need to look at who should be involved in that change. Who's the team that we need to put together to actually ensure that change, if it's a significant one, is successful.
Absolutely. And the way most organizations are handling change is they are going straight for the operation without the anesthetic, without the antibiotics, without any of the prep work. They're going straight in for the operation. That's the equivalent of what organizations are doing with change.
So that reminds me of a.
So why wouldn't a patient scream, no?
That makes me think of an acquisition that failed just recently. So a company bought another company at a discounted rate, and they thought, oh, we can fix that. But they didn't consider how they were going to fix it. They didn't consider what they needed to do in advance. They just thought, oh, we can do it. We'll just change it. We'll put them into our system and it'll be fine.
How hard could it possibly be?
Yeah. Well,
and 85% of CEOs post M&A wish they'd paid more attention to the people side of things.
Yeah.
And what they're saying is they didn't understand how people needed to be handled to elegantly go through that change because they needed an anesthetic.
Yeah. Well, it puts the people under stress, doesn't it?
Yes, it does. Massively, which is why we want to measure who's excited about the change and who's overly stressed about the change. That also goes into the phases.
So you've got the stress that they're measuring. What other types of things would you be measuring?
We're measuring rigidity. We're measuring who's going to dig their heels in and who's going to want to go full speed ahead. We're measuring the excitement. We're measuring the size bites of change that they'd like to take in. Do they want little bitty bites or do they want big bites? How much chaos can they handle, right? What's the pain threshold?
But it's going to be different for different team members, isn't it?
It's going to be different for different team members, and it's going to be different for different departments.
So the involvement of one compared with the involvement of another might need to be managed differently. Yeah. The engagement might need to be higher in one and lower in another. The explanation, the one-to-one sessions, or somebody might just be fine with the SOP.
Exactly.
But you don't know until you do the assessment.
Until you do the assessment, until you have conversations, until you start changing the environment, until you start changing the very system that people are working in.
And then you're planning for success.
You're planning for success.
I think that's an important thing to consider, especially, I know it's this time of year when everybody's talking about the plan for the next year, but a lot of people plan too late. A lot of companies, a lot of organizations, they think, well, our system says we've got to have our goals in place for the new year. So they start planning them at the beginning of the new year, and it takes them till the end of the first quarter to actually identify what the goals or objectives they want for that year. And that,
Exactly.
that
And
really frustrates me because
and today's problems are a result of yesterday's solutions. So we created our problems today from something we did 6 months, 12 months, 18 months ago.
and whereas what we should be doing is planning for the future, predicting what we need, identifying what the people need, implementing the systems with the people, not just the systems.
Yeah. With the people side, it looks like we start slow. We do the analysis. We understand the ground that we're going to be walking on. Because at the other end of it, if we do it right, then the change happens and it happens successfully and it can happen rapidly, but only if you've got that beginning people piece right up there up front.
And you've done the assessment and you know the profiles. Cool.
You've done the groundwork.
Sounds good to me. Okay, I think we're going to end it there for today. Natasha, thank you very much. That's Paul Palmer and
Natasha Todorovic Cowan signing out.
thank you. I'll talk to you again soon.